A patient walks in my OPD, and the minute I could talk to her, she collapses. After resuscitation, then we get to know she was pouring, bleeding. Once we examined her, we found out she had a lot of fibroids. Hi, I'm Dr. Mukti Harne Paithankar. I'm a consultant practicing in Gurgaon. Well, what are fibroids? Fibroids are nothing but excess of mass in the uterus, around the uterus, or in the muscle of the uterus. There are different positions according to which the fibroid acts. If it is outside the uterus, maybe the fibroid will not present with any symptoms. When it is inside the uterus, maybe one presents with a lot of bleeding in the cycle, irrespective of the cycle, in between the cycle. If it is inside the uterus, in the muscle of the uterus, the presentation would be different. What is the management of these fibroids and how do we get fibroids? Well, to answer this question, generally genetics is the only major point to be highlighted. If fibroids is running in the family, like if the mother has fibroids, the daughter gets fibroids, and also henceforth carried on in the family. Other cause is eating a lot of red beef or non-vegetarian diet. And number 3, it is also taking a lot of hormones, exogenous hormones, hormones from outside in the form of eye pills, MTP pills, OCB pills, or contraceptive pills. Fibroids do grow in size in pregnancy, but they also revert back to its normal position once the pregnancy is over. If the fibroids are not symptomatic, or the patient is having no symptoms like heavy bleeding, pain in abdomen, a lot of pressure on the anterior side causing bladder symptoms, then the fibroids are not to be touched. But if the size of the fibroids are huge, that is even more than 4 or 5 centimeters, then it is recommended to remove them by doing surgery. Surgeries can be either removing just the fibroid, doing a myomectomy, or removing the entire uterus, that is called as hysterectomy. One is open surgery, which is laparotomy, and other is minimal accessive surgery, that is laparoscopic surgeries. Both the surgeries can be done by the gynecologist, and a complete procedures is explained prior to that. So if you have any of these symptoms like heavy bleeding, pain, pressure symptoms, or feeling heaviness in the lower abdomen, do visit and let us know your problem. Thank you.